Hello my dear friends, welcome back to my YouTube channel. Myself Rakesh Kumaran, working at AIIMS Hospital. Today class I will discussing important image based questions for NORCET and other competitive exams. So let's begin with most frequently asked images and their uses. Simple face mask used for short term low to moderate oxygen delivery to patients. It is most commonly used in emergency. It will be delivery 5 to 8 liter per minute. FiO2 40 to 60%. Nasal prongs or nasal cannula. There are two types of nasal cannula: low flow nasal cannula, high flow nasal cannula. They deliver supplemental oxygen through two soft, flexible tube inserted into patient's nostrils. Flow rate of nasal cannula is 1 to 6 liter per minute. FiO2 24% to 44%. High flow nasal cannula or HFNC is a non-invasive respiratory therapy delivering warm humidified oxygen at high flow rate through nasal cannula to support patients with respiratory distress. Venturi mask used to deliver a precise concentration of oxygen to patients who required controlled oxygen therapy, especially those who with chronic respiratory disease like COPD. Available color of Venturi mask is blue, white, orange, yellow, red and green. Flow rate of Venturi mask is 4 to 15 liter per minute. FiO2 of Venturi mask is 24 to 60%. Tracheostomy mask used to deliver oxygen directly to patients with tracheostomy tube, delivers humidified oxygen to patients through tracheostomy stoma. Venturi tracheostomy mask. Non-rebreather mask or NRBM is a high concentration oxygen delivery device used in emergency and critical care setting. It delivers a high fraction of inspired oxygen to patients who are hypoxic or in respiratory distress. NRBM will deliver 10 to 15 liter per minute. FiO2 of NRBM is 16 to 100%. Face tent mask used to deliver humidified oxygen through a loose fitting tent that covers the nose and mouth. Face tent mask commonly used in burn patient and facial trauma patients. Face tent will be delivery 4 to 8 liter per minute. FiO2 of face tent is say 30 to 50%. Oxygen wood. An oxygen wood is a clear plastic device that covers an infant or young child head to deliver warm humidified supplemental oxygen to those who can breathe on their own but need extra oxygen. Oxygen wood flow rate is a 10 to 15 liter per minute. FiO2 is 80 to 90%. Nebulizer is a small machine that turns liquid medicine into steam that can be easily inhaled. Nelson inhaler used for inhaling steam to relieve respiratory problems like cold, flu, cough and sinusitis. Bain circuit used in anesthesia to deliver oxygen and anesthetic gases to patients during surgical procedures. Nasopharyngeal catheter used either to clear secretion from airway or to maintain patient's airway by acting as a nasopharyngeal airway. Spirometers have two main uses. First is incentive spirometry, is a therapeutic device that uses visual feedback to encourage patient to take slow, deep breaths, which helps to clear airway, prevent lung infection after surgery, and strengthen the respiratory muscles. Second one is diagnostic spirometry, is a pulmonary function test that measure lung volume and flow rate to diagnose and monitor lung disease like asthma and COPD. Oxygen cylinder. The color of an oxygen cylinder with black body and white neck. Oxygen flow meter with humidifier bottle. Oxygen concentrator used to provide supplemental oxygen for people with chronic respiratory conditions such as COPD, asthma, and sleep apnea, as well as COVID-19, cystic fibrosis, or pulmonary edema. They function by filtering nitrogen from the air and delivering purified oxygen to the patients, helping to improve blood oxygen saturation. Medical gas pipeline and colors. White color for oxygen, blue color for nitrous oxide, white with black for medical air, black for instrumental air, yellow for vacuum suction, grey for carbon dioxide. The Malampati score is a pre-operative assessment used to identify difficulty of intubation by looking at patient's mouth. There will be 4 classes: class 1, class 2, class 3, class 4. Class 1, we can see hard palate, soft palate, uvula and pillars. Class 1, we can easily intubate. Class 2, we can see hard palate, soft palate, uvula, but pillars not seen. In class 2, we can also easily intubate. In class 3, hard palate, soft palate, base of the uvula visible. Class 3 is moderately difficulty to intubate the patients. Class 4, the only hard palate we can visible. It is very difficult to do intubation. Endotracheal tube. Endotracheal tube, we can see there are so many types of endotracheal tube. This is cuffed endotracheal tube. This is non-cuffed endotracheal tube. This non-cuffed endotracheal tube we are using to pediatric patients less than 5 years. Endotracheal tube used to assist with the breathing during surgery or to support breathing in the people with lung disease, chest trauma or airway obstruction, etc. Flexometallic endotracheal tube used for airway management in procedures involving flexible head or neck positions such as head, face and neck surgeries. Cause: continuous aspiration of subglottic secretion. Used to prevent ventilator associated pneumonia by using an additional lumen to suction out the secretion that accumulated above the cuff in ventilated patient. We can see the additional lumen is here. This port for inflating balloon. This port we can connect to suction. Double lumen endobronchial tube DLT used for one lung ventilation during thoracic surgery. We can see this is bronchial, this is tracheal. Double lumen endobronchial tube is available in right side and left side. We can see this is tracheal tube inflated, this is bronchial tube inflated. We can see the double lumen endobronchial tubes parts: tracheal lumen, bronchial pilot, tracheal cuff, bronchial cuff. ET cuff pressure manometer used to measure and adjust the pressure inside the cuff of the endotracheal tube to ensure a proper seal and prevent complication. EMG tube or electromyographic endotracheal tube used during surgery to monitor the recurrent laryngeal nerve integrity, especially in neck surgeries like thyroidectomy, by detecting nerve activity and alerting the surgical team to potential damage. NIM or nerve integrity monitor is used to intraoperatively to locate, monitor and stimulate a nerve to help surgeon identify and protect them from damage during procedures such as ENT, head and neck, spinal and general surgeries. We can see this is EMG ET tube. This connected to NIM monitor. Blue color one is nerve stimulator. Bougie. used to guide and facilitate the placement of endotracheal tube during intubation, especially in difficulty airway cases where visualization of vocal cord is limited. Laryngoscope, used to visualization of larynx and often used during general anesthesia surgical procedure around the larynx. This tool is useful in multiple hospital settings, from the emergency department to the intensive care unit and the operative room. Video laryngoscope, used for managing airways, particularly difficult one during tracheal intubation. Ambu bag, uses to deliver breath during cardiac arrest and CPR, assisting with airway management during intubation, providing temporary ventilation during patient transport and etc. Suction machine, uses a vacuum to remove body fluid like mucus, blood and saliva from patient's airway or surgical site, ensuring they can breathe and preventing complications like pulmonary aspiration. Suction catheter, this is open suction catheter, this is closed suction catheter. Suction catheter, used to clear respiratory airway by removing mucosa, blood, vomit and other secretion that can cause obstruction and impair breathing. They are essential for patients unable to effectively cough and clear their airways. Yankor suction, used to remove blood secretion and other fluid from mouth or surgical site to maintain clear airway, preventing aspiration and ensure a clear view of surgical procedure. Rales tube, used for feeding, medication delivery and gastric drainage when a person cannot eat or swallow normally. Mucus extractor, used to clear secretions like mucus and amniotic fluid from the respiratory tract, primarily in newborns, children and patients with breathing difficulty to ensure free respiration. Nasal aspirator, when baby nose is stuffy, a manual nasal aspirator can help to clear it and make it baby more comfortable. A manual nasal aspirator is a simple way to clear baby nose. Tracheostomy tube, this is metallic tracheostomy tube, this is plastic tracheostomy tube. Tracheostomy tube used to administer positive pressure ventilation to provide a patient's airway and provide assist to the lower respiratory tract for airway clearance. Goodal airway, used to maintain an open airway by preventing the tongue from obstructing the throat in unconscious or sedated patient. LMA or laryngeal mask. LMA is a subglottic airway device used by medical professionals by provide temporary airway support and ventilation, especially in cases of difficulty or failed endotracheal intubation. Anesthesia machine, used in surgery to administer anesthesia to patient, ensuring they remain unconscious and pain-free throughout the procedures. Ventilator machine, ventilator or mechanical device used in medical setting to assist or replace the patient's breathing when they can't breathe effectively on their own. They provide oxygen and air through the lungs to help maintain body function. Anesthesia vaporizer, used in operating room and other medical setting to ensure patients receiving safe and precise level of anesthetic gases, accounting for factors like ambient temperature and fresh gas flow rate. Portable ventilator machine, used to provide respiratory support to patients who need assistance breathing both in and out of the hospital setting. They are particularly useful for emergency transport, home care for those who with chronic conditions. Ventilator circuit. A ventilator circuit is a gas pathway, typically flexible tubing that connects a mechanical ventilator to patient's lungs. delivering oxygen, removing carbon dioxide, and providing respiratory support. Catheter mount is a flexible connector between patient's endotracheal tube or tracheostomy tube and their breathing circuit or ventilator. HME filter or heat and moisture exchanger used in patient requiring mechanical ventilator or those with tracheostomy to warm, humidified and filter they inhale. NIV, non-invasive ventilator, uses external mask to deliver respiratory support for various acute and chronic conditions including COPD, acute heart failure and neuromuscular disorders. Help to improve gas exchange, avoid intubation, relieve respiratory distress and facilitate weaning from the mechanical ventilation. This is IV cannula. In this IV cannula, we have to know color and sizes. 14 gauge is orange, 16 gauge is grey, 18 gauge is green, 20 gauge is pink, 22 gauge is blue, 24 gauge is yellow, 26 gauge is purple. For blood transfusion, ideally we select green color. Scalp vein set or butterfly cannula. IV set. In this we can see this is micro drip, this is macro drip. Micro drip it will come 60 drops per ml, macro drip it will come 10 to 20 drops per ml. Blood transfusion set, it's similar as a IV set but additional feature like there is a filter on this chamber. PDR drip set, used to deliver small controlled amount of IV fluids or medications to children, minimizing risk like fluid overload, which is more likely in smaller patients. Infusion pump, used to deliver liquid such as medications, nutrients or blood into patient's body with precise controlled flow rate and volumes, which is essential for treatment that cannot be administered manually. Syringe pump, used to deliver fluid like medications by using a motorized mechanism to push the plugger of the syringe at a controlled rate and volume. PMO line or pressure monitoring line, used to accurately measure and transmit fluid pressure such as blood pressure. Three-way stopcock and three-way stopcock with extension tube, a medical device with 3 ports that enables healthcare professionals to manage and administer multiple fluids or medication simultaneously through a single IV line, reducing the need for multiple access points. Central venous catheter, used for administering a large volume of fluids, blood transfusion, chemotherapy and potent medicines as well as for drawing blood sample, hemodynamic monitoring and providing parenteral nutrition. CVP manometer, used to either continuously or intermittently measure the central venous pressure of the patient. Transducer CVP, used to measure central venous pressure by converting the fluid pressure from a central venous catheter into a continuous electrical signal displayed as a waveform on monitor. Pressure transducer, used for pressure monitoring device, used for continuous monitoring of atrial, central venous pressure, etc. Usually pressure transducer used in operation theatre, ICU and emergency setups. PICC line or peripherally inserted central line catheter. It is a thin, flexible tube inserted into a vein in the arm. that is guided into a larger central vein near the heart. PICC line provide long-term access for giving medications, fluids, blood transfusion and nutrition, as well as drawing blood sample. Dialysis catheter. Hemodialysis catheter, which are placed in a large blood vessels to draw blood for filtering and returning it. Peritoneal dialysis is a type of dialysis for kidney failure that uses the lining of patient's abdomen as a natural filter to remove waste product and extra fluid from patient blood. Hemodialysis machine that functions as artificial kidney to filter waste, toxins and excess fluid from the blood of the patient with kidney failure. Dialyzer. A dialyzer acts as an artificial kidney to filter waste product and excess fluid from the blood when person's kidney are damaged or failed. Automated dialyzer reprocessing machine used to clean, test and disinfect reusable dialyzer for hemodialysis in clinical settings, reducing medical waste and improving cost effectiveness where dialyzer reuse is practiced. Thank you for watching this video. I hope it was useful. Don't forget to like, share and subscribe for more videos. Thank you.